All right, we are back with another bonus episode from our Know Your Options series. This is going to be all about COVID-19 and how that's going to be perhaps affecting your childbirth experience. When this first, when the shutdowns first started in the U.S., I feel like Stephanie and I were just flooded with questions and concerns and unknowns, and we were just trying to keep up with it, with everyone else. So I think a little bit more has come out now. There's been some studies. We've had a lot of conversations with people that have gone through it, and so we have a little bit better of a handle on it now. And so I have our childbirth course instructor here today, Stephanie Spitzer-Hanks, and we're going to be talking about what she's seeing and kind of how you can prepare during this time. So welcome back, Stephanie.
I'm so glad to be here.
All right, so let's just get right into it. What do you think are the best things for our listeners to know right now just to prepare for their births during this crazy time?
Yeah. And the thing is that things keep changing and policies keep changing at birth locations. And so my absolute number one tip for everybody is to call your birth location to find out what their current policies are and call, and if you're still waiting to go into labor and a few days have passed, go ahead and call again and make sure that things are still the same. I've done this myself and talked to L&D nurses on units, and they've always been really open and ready to kind of share and walk me through exactly what's going on. I would say don't necessarily go by what your OB is telling you at their appointments because they don't always know what's current. They just kind of pop in and, catch the baby and then leave again. So they're not always up to like what the admission policies are and like what people need to go through like during triage. So I wouldn't necessarily assume that your OB or midwife is totally current. So call the unit and talk to the nurses on the unit and they will tell you what's going on right now.
Yeah. Hopefully it's not changing every day anymore. Cause I remember hearing, back in March and April that even nurses, when people would show up, they'd be like, oh, you can't have a doula? We didn't know that. It was like the official hospital policy, certain things that the nurses weren't even aware of because it was changing so often. But like you said, I think just calling every few days is probably your safest bet to make sure you know what the latest is.
Yeah, for sure. And as we head into fall, like I can only imagine that things are going to be even more volatile. So yeah, so it's definitely say just call. If you have any questions, just call.
Yeah. And if you are wondering about some questions to ask that are not just COVID related, we had that entire bonus episode a few weeks back all about, how to make sure your hospital is evidence-based. And there's some great questions that you would typically ask on a hospital tour, which may not be an option right now, but you can certainly call and get those questions answered. So be sure to print out that bonus download so you have that on hand. All right, so that's kind of one thing people can be doing to prepare. What are some things that they can just expect to maybe be different or to not be available to them that would have been prior to a pandemic?
Most things are more or less the same. You may have to wear a mask while you're in labor. Your support person may have to wear a mask. So I always encourage people to practice the comfort measures that they're planning to use while wearing a mask so that that's not the first time they're doing it when they're in labor. So like breathing techniques, because I really go through this a lot and encourage people to use deep breathing as a way to focus and to work themselves through a contraction. But I would try that with a mask on at home before you're doing it in labor. And just try using it with different kinds of techniques that we talk about. I definitely recommend for people to be sure that your partner is also really well prepared with comfort and advocacy skills, because that may be your only support person. And, one of the things that I talk a whole lot about in the course is how great doulas are and how everyone should have a doula, and doula support is invaluable. And I still believe that. But I think it's very, very important for the partner, even more important for the partner, to really be clued in and to really pay attention in childbirth class and practice those skills, because it's mainly going to come down to them. You can't rely as much on having a doula there. Some places, doulas are not considered a support person. Like most of the time, you can only have one person from your life with you. So whether that's your, spouse, mother, sister, whoever it is, who's your main support for your pregnancy is going to be able to come and be there for your birth. Like way back in the beginning of the pandemic, some places tried to limit even having one person with you, and that pretty quickly got shut down because everybody recognized that was a terrible idea. So you're going to be able to have at least one person with you. You may be able to have a doula because sometimes doulas are not counted as a personal person. They're counted as a professional. But in a lot of places, even doulas are not able to come in with you. So I still do recommend having doula support. Doulas have gotten real creative and figured out ways to provide virtual support. Also, they can, a lot of times they can support you at home when you're in early labor and help to make sure that you don't go to the hospital too soon. But they may not be able to come in the doors with you. And so from that point on, you may have them, in earbuds in your ear, or have them up on a tablet that you have propped up on the table. Or you may just have them on call that you kind of check in with them periodically over the phone. So, just different places have different Wi-Fi connections. So sometimes you have to get creative even with the way that you're communicating with your doula, but it's still valuable to continue communicating with the doula because they can help guide you with questions to ask. They can help guide you with comfort measures to try. It's certainly not ideal. The ideal would have your doula right there with you, but having their support in your ears is also extremely valuable. And I think that people have started to kind of recognize and shift their expectations around what that is. It's not a doula or no doula. You can have a doula. It might look different than it would have before this whole thing broke.
Yeah, this topic came up in our Facebook group, right when the shutdowns were happening. And I remember my initial reaction was kind of like, yeah, I don't think a doula would be worth the expense if they can't be there with you. But since then, I've heard so many positive experiences about virtual doula support and just having, like you said, a tablet there where they're just literally there the whole time. And nurses saying even how impressed they were with the ability of support doulas have been able to offer virtually. So, and it might be a more affordable option as well. Some doulas are, discounting their services because they can't be there in person. So it's definitely something to look into.
Yeah, I wouldn't dismiss the idea out of hand. I would look into and at least talk to some doulas who do this. And the other good thing is it doesn't have to be somebody necessarily local to you. Right. There's doulas all over the place that are providing virtual doula support. So you can really get somebody who specializes in something. I remember somebody in our group, in our Zoom calls for the course, we're talking about how, she had a history of sexual abuse. And so she ended up using a doula who specialized in trauma-informed care, who was not local to her, but was able to provide virtual support. And that was really helpful for her. Mm-hmm. So you can even kind of branch out into other areas. You don't have to be somebody local to you.
Mm-hmm. Okay. So any other, main things you want to touch on that maybe are not available because of the pandemic?
Yeah, the big one is support by more than one person or having a doula with you. Sometimes I have heard that in some places that offer nitrous, which is not widely available in hospitals in the U.S. anyway, that they were not offering that because of, just the extra breathing that was involved. And I think that it may matter whether your results are back and whether you've come back with a negative test. Like if you're negative, then, you can breathe as heavily as you want, presumably. But, it may be that nitrous is not 100% on the table for everybody. It's also not really widely used anyway. Another thing that's not super widely available in hospitals is water immersion or water birth, which is not exactly the same thing because a lot of hospitals who do have tubs will encourage their use only for laboring, but not for pushing and not for giving birth in the water. They'll have people get out. Some hospitals, of course, rarely, but it's possible that you can find a hospital that does encourage water birth. The thing with that now is that from what I understand, I think it's just so variable from one place to the next. People are really flying blind. The hospitals are flying blind. They're trying to figure this out on the fly right now. But one of the things I've heard about why water immersion and particularly water birth may be off the table is that COVID is detectable in stool. And so one of the things that happens when you start pushing is a lot of times there's some poop also. And so if, you poop in the water and it's contaminated, then that's a real problem for all the people who have to put their hands in that water. They're wearing gloves, but still, potentially the baby being exposed at birth. So I think just out of not knowing that having water birth is pretty much not happening in any hospitals. And even just being immersed in water, I think just because of the risk of there being contamination in the water and then contaminating the tub. And what if it doesn't get completely cleaned in between?
Yeah, that's what I've been hearing. It's one more thing for them to have to worry about sanitizing.
For sure.
Which obviously everything's being sanitized, pre-pandemic, but I think it's just people are so hyper focused on it right now that it's that's a really giant thing to sanitize between people.
For sure. And something that is not strictly a necessary item. So it's something that they can take off their plate. I would say also kind of in that same vein, something that's large and has to be sanitized is birth balls or peanut balls. So that would be something I would definitely ask, if the hospital unit has those available for people to use and if they're still available during this time, because you can always bring in your own.
Right.
But that would be something that I would ask about.
Yeah. All right. So we talked a little bit in our last bonus episode about inductions. We talked a little bit about testing and how that might come into play. So let's dive into that a little bit deeper, because I know testing in some places is widespread with every person that comes in to give birth, regardless of whether it's an induction or spontaneous or cesarean. So what are you seeing? Is it really just one of those call and ask the hospital, or what can people expect?
I think typically most hospitals are requiring across the board for any planned procedure, they're requiring a negative test. And this may vary 2 days before, 3 days before coming in for a planned procedure. So, and planned procedures in the case of L&D would include inductions and cesareans. But for spontaneous labor, there's different tests that are out there and being used. So that would definitely be something to ask. Are we talking nasal swabs? Are we just doing a cheek swab? How rapidly are those results coming back? What can I expect to have happen while I'm waiting for my test results to come back? I recently had a client local to me that had to spend quite a long time in triage, which she wasn't necessarily anticipating, because just waiting on her test results to come back. They weren't going to let her out of triage until they knew she was negative. That would be one of those things that I would definitely ask, what is your procedure around spontaneous labor and testing, because it's going to vary. But pretty much everybody is requiring testing of every patient. So, but usually it's just the patient that's being tested. So then the support person is not being tested. And often the support person is required to wear a mask the whole time. The person in labor may or may not be required to wear a mask the whole time. And required, you can't see my air quotes, because
yeah, that's what I was just
a lot of times, by the time you're really thick into labor, you've ripped it off, and it's, especially during pushing with a mask on is pretty challenging from what I've heard from people and what I can imagine. So it may be that you don't keep it on the whole time, and they're prepared for that. The hospital staff, they have the N95 masks. They're keeping themselves protected with their personal protective equipment, but they, would prefer that you wear a mask the whole time. I guess that's the way we could put it.
Right. Okay. Are you seeing that there are more elective inductions and cesareans being encouraged, suggested, anything like that? And if so, what should people know if their provider is recommending something like that to them because of COVID?
Yeah, I mean, and we have this new podcast that we're putting out about induction, so I definitely recommend people go and read that. But it can vary. Sometimes people are doing more elective inductions just for a sense of control and being able to do that testing beforehand. And so it may be that your care provider is saying, well, this is really what I recommend, that you have an elective induction, or cesarean, though I think that's probably less likely. maybe more likely in the incidence of if you were wanting a vaginal birth after cesarean, that may be less likely to happen. I don't know. Again, this is really going to vary, but it could be the recommendation that your care provider gives you. And what I really think people need to know and remember is that it's always your choice whether you want to consent to an elective induction or an elective cesarean. So you get to say whether you want to do that or not. And you need to ask the questions like, is there, a medical indication for this or is this purely an elective induction for convenience, for control, for what reason, really digging into what is the reason you're recommending this, and then checking in with yourself, checking in with your partner, like, is this something I'm comfortable with? Is this something I want to do? And if not, then you are not required to have an induction or a cesarean. It's always your choice to consent to any kind of intervention that's being proposed.
Yeah. So, keeping in mind that this is just going to look different depending on where you are in the country or, around the world. We have quite a few students from Canada, and it's always interesting to me to hear how they're doing things differently there. But what are the main things that you are telling our students to do to prepare, just their mind and then physically, obviously, things they can do for their birth? Sure.
Yeah. I think if people are feeling a lot of anxiety about being in a hospital and giving birth in a hospital, and I would remind people that hospital is maybe not your only option. You might consider community birth as an option for you if you're low risk, if you have birth center or home birth midwives that are available in your area. You might be worth talking to them if it's really causing you a lot of anxiety, thinking about being in the hospital and having the restrictions that the hospital is placing and potentially having exposure, being around that many people, even with testing, we know that sometimes things slip. So, if that's causing you a lot of anxiety, maybe consider community birth and look into that. So it's always, it's not always an option, but it often is, and maybe one that's being overlooked.
And I just want to jump in. That's a newer term, I think, since we first did this series. We were calling it out of hospital birth, and now community birth is more commonly used. So for anybody who's wondering about that, it's not like giving birth at a community center or anything like that. It just is referring to birth centers and home births.
Right. Yeah. And it's just a little simpler to say community instead of birth center and home birth, because it does refer to, and out of hospital has always been a mouthful too. Yeah. So yes, you're right. This is kind of a newer term that's becoming used. So I'm trying to get used to it myself.
Yeah.
So community birth, think about that perhaps. And regardless of where you give birth, it's always important to be informed, to know your rights, to practice advocating for yourself. This is something that we definitely cover quite a lot in our course, is, what are the options that you have? And, how can you best speak up for what it is that you want? And how can you have productive conversations with your care providers that are going to end up in shared decision-making between you and your care provider? So, just because there's a pandemic on doesn't mean that your rights are flown out the window. You still have the same rights to choose what interventions are happening in your birth and to have true informed consent. Those things have not changed. You still have all the same rights in birth. You may not be able to have all the same people with you, but you still have all your same rights. So, so looking into virtual support, we talked about that already, and about like practicing your comfort measures with your mask, making sure your partner is prepared. These are all things that, kind of already mentioned, but I wanted to reiterate because I think they're super important. If you're planning a spontaneous labor, laboring at home as long as it's safe for you to labor at home. And again, this is where a doula can really be helpful to help you know when it might be time for you to go. Typically doulas don't do anything medical. They aren't going to do a cervical exam on you to say like, okay, you're 6 centimeters, now it's time to go. But just by listening to you and looking at you, kind of talking with you about what's happening, they have a pretty good guess of when you might be around 6 centimeters, if that's your goal. So having a doula supporting you at home, either like in your home or virtually, can help you stay home as long as it's possible for you to, and then show up in active labor Definitely bringing the food for you and for your support person, just in case you're restricted to staying in your room. And kind of on the topic of knowing what your rights are, and knowing kind of what the research is currently, because it is shifting and new information is coming in all the time. I always recommend going to look at Evidence-Based Birth's page on coronavirus. So it's evidencebasedbirth.com/COVID-19. And they have all kinds of information there. It's quite a lot of information. But one of the things that's at the top of the page is a sample informed consent form to refuse separation of the birthing parent and the baby. Because this is something that has been evolving, and fortunately more American organizations have been changing their official stance and policy on this, about not separating the parent and the baby at birth, even if the parent has tested positive or is showing symptoms. It still seems to be a safe option to keep the parent and the baby together and to encourage breastfeeding. There's no reason to not breastfeed because you're COVID-19 positive. There's, up to now, again, new information all the time, but it hasn't been shown to be transmitted through breast milk. So that's good news. It may mean that you need to wear a mask. It may mean that you physically are not up to providing the bulk of care for your infant because you're sick, in which case you may need to pump and have somebody else give milk in a bottle. But there's lots of things to consider about how you would care for your baby, but it's not a given that it's the best thing to separate you from your baby, because there are actually a lot of risks with separation, risks for low bonding. And there's a lot of research out there that says it's a really good idea to keep birthing people and their babies together after the birth and not enforce any kind of separation. So again, on the Evidence-Based Birth website, there's a consent form that you can print out and bring with you just in case. Mm-hmm. And it's a way to help advocate for your right to keep your baby with you if that's what you want to do.
Yeah, and I'll link to that from the show notes page for this episode. Okay, so before we wrap this up, I just want to cover postpartum considerations.
Oh, for sure, yeah.
In regards to this new world we're living in. So what are the things that you're recommending and seeing right now?
Yeah, because it's just so hard to have a baby anytime. And then now that there's so much more isolation, and it's even harder. So my heart really goes out to folks that are home. I mean, in one sense, we've heard from people in our group that, hey, it's kind of nice because I'd be staying home anyway. And so now I'm just staying home and my partner is going to get to work from home. So now my partner is able to be here more. So in some ways there's a silver lining there. But in other ways it can be hard to get in-person support, because you don't necessarily want to have people coming in like you otherwise might have done, bringing you meals and holding the baby for you while you go take a shower. I mean, you really have to think a lot more carefully about the people that you allow into your home. And, we have that other podcast that we did about setting boundaries, which, would recommend going and listening to, and making sure that you have really clear communication with people, because you're going to want to make sure that the people that you invite to come in and help are being as cautious as you need them to be. And that's going to look different for different people. Some people are not going to be as much as sticklers about things, but if for you, what you need is to know that somebody has a negative test before they come, then you need to ask them for that. If you need to know that they've quarantined for 2 weeks before they come, then you're going to need to tell them that's what you need. And I think that those are reasonable requests. It's not unreasonable to try to protect your family in this really vulnerable time. So, But the downside of that is that you might end up with less support in home. So, fortunately, there's some lactation professionals that are doing virtual telehealth consults. So you can still get that help with breastfeeding if you're having trouble. There's also mental health professionals that are doing telehealth consults. So if you really are struggling and you need to reach out for mental health support, make sure that you've researched this before you have your baby. I'm always, always, always recommending to people to prepare ahead of time as much as possible for the postpartum period. It's just going to look different now because you can't just go out to an appointment. You can't just have somebody come in. You got to do a lot more planning around it. So I'd say definitely start before you have the baby. Figure out who you could call for breastfeeding support. Figure out who you could call for mental and emotional health needs. Figure out how you're going to communicate with your extended family, if you have that as an option for you. Figure out how you're going to tell them what you need them to do before you're going to feel safe having them in your home.
Yeah. Yeah. And on the, mental and emotional health thing, I think looking into finding some kind of friend support or, parent group to be involved in. I know that with our, Zoom calls with our childbirth course students, it's actually been really nice because they can come, be part of our postpartum, pregnant mom group, even when their baby was born yesterday, which is not something you would have ever been able to do, going to an in-person group. Probably you wouldn't be getting out of the house that quickly and just come on and share their experience. And it's been so nice. And same thing with our Patreon group. We've been having regular Zoom calls since the beginning of the pandemic. And I think we all need that, just venting and emotional support. We're all in this together. That aspect of it is so important too, especially postpartum when your emotions are all over the place.
For sure. Because it's such a unique period in your life anyway. It's so emotionally huge, caring for an infant and it doesn't last that long in the grand scheme of things. So, but trying to find somebody else who's going through that around the same time as you and add the other layer of somebody doing that while there's a pandemic on, So finding either like formal groups that are doing virtual support or, just hobbling together something informally, throwing out an SOS on your Facebook page, like, hey, who do I know that would be interested in setting this up, like finding a way to make that happen for you.
All right. Well, thank you so much for coming on to talk with me about this today. If anybody's interested in joining our Know Your Options Childbirth course, you can do that at thebirthhour.com/course. And we're still offering the $100 off with the coupon code 100OFF. And again, that's thebirthhour.com/course. Thank you so much, Stephanie, for coming back on and chatting with me about all this pandemic craziness.
Well, always a pleasure to talk to you. Not necessarily about craziness, but always a pleasure to talk to you, Bren. And always love to talk about birth. So let's do it again.
All right. Sounds good.